Good afternoon, folks. We're going to get started in a few minutes with the more, I don't even want to call it formal, but the more presentation-y type part of this meeting. Before we do, though, we are going to be breaking out. Unfortunately, we did not get tables to convene everybody at, but in the second part, we're going to be arranging ourselves into community, by community size that you're coming from. So before everyone gets settled and really comfy in their chair post-lunch, we thought we might actually move you around now. So if you are from a community that you feel fits the definition of, and I'm not going to try to define, more small town, rural, and remote, you're going to be up here in this corner and using these sheets of paper later. So you want to come into this cluster in here. I feel like I'm picking on people because I know some of you are not, you're not rural and remote. I know where you're from. And then if you are from more of a mid-size community, I don't know what you want to, yeah, not an urban center, you're going to be back in the back corner. Sarah, could you kind of lift up your hand, Sarah Sadler? Yeah, so that region of chairs. Okay, and then if you are from a more kind of urban center, I'm going to pull you in over this side. Okay, so right now, urban, small town, rural, mid-sized community. Okay, thank you. Okay, can I get everyone to grab a seat somewhere in your region of the chairs? And just as a reminder, we were suggesting that small town, rural, remote, down here, this corner, urban, that side of the room, and mid-sized community toward the back corner. And now I know some folks are saying, I'm here from a group that's provincial or broader scope. You get to pick. Where do you want to slot in? Who do you want to listen to? Okay. Okay. Are you standing just because you want to stand? You're done with sitting? I totally get it. Okay, good. Then we will get started. Maria, can we shut the door now? Can everyone hear me? The mic feels weirdly low, but you can hear me when it, perfect. Okay. Good afternoon, everybody. I'm Alison Dunnett. I'm here from BC Housing with Erin O'Shaney from the Ministry of Housing in BC, and just really thrilled to have so many folks choose to participate in this BC workshop today. I want to start with acknowledging that we're standing today on the traditional unceded territory of the Anishinaabe Algonquin peoples, and I am very, very excited to be here and honored to get to be on these lands that have been stewarded since time immemorial. We had this session last year. Who was here last year in Halifax? Yeah, a handful of people. I think we were maybe 20 or 25 folks from BC last year who came together. I don't think that was the full attendance at CAH from BC, but this year there were over 200 folks who came from BC out here, and I think that's a really exciting thing to see happening within this conference, and I hope everybody else is getting a lot out of it. I know I have in the last 24 hours for sure. We want to keep this as informal as possible in a room this big. We didn't know what we were going to have in terms of turnout, and so the goal really is to converse and connect on what's happening in BC, to learn from one another. For the looky-loos who've come to hear what's going on in BC, this is your opportunity to tap into some pretty special people who are doing, I think, incredibly exciting work in Canada. We're going to start with a few slides from BC Housing and the Ministry, just talking about some of the recent initiatives that are underway in BC, and then we're going to break out into the groups, and we have some questions for you guys to work on together. I'm going to come, you're too big a room, so I'm going to come back. I'll suggest we come back to this when you're working in your groups. But just for now, maybe if you can, turn towards somebody around you you don't know, and let them know where you're coming from, what's the organization you work for, and the group that you're with, and something you might want to share quickly about the work that you're doing. Great. Lively, chatty bunch. This is good. Aaron and I are going to walk through a few slides on current provincial programs in BC focused on homelessness. And so I'm going to invite Aaron up to talk to the first slide. We're going to go back and forth here.
Thank you. Hi, everyone. Erin O'Shaney from Ministry of Housing in BC. I'm just going to give a quick overview of our Belonging in BC Homelessness Provincial Plan, which I'm sure some of you are already familiar with. The initiatives that we'll do some referencing to really are positioned within this provincial plan. It launched in 2023, and it's a big first. It's the first time that we've had a comprehensive provincial plan with sustainable funding, over $1.5 billion over several years. And the first time where we had a number of joint mandate letters telling us to work better together. So quite a primary focus of the direction that we received was about coordination and integration. And not just with our partner ministries at a provincial level, but also making sure that we were working with the different levels of government, particular with municipalities and regional government, and also looking right into community for those who really are the experts in that day-to-day context, and making sure that we're working together with our Crown agency, with community organizations, with local governments, and Indigenous serving organizations as well. So this was a first for us, and you see a number of the initiatives listed here on the slide. This is really a snapshot, and if you just Google Belonging in BC, you'll see the comprehensive plan here, but you can see the complexity of the programs and just how ambitious this mandate was. A number of these initiatives are still very early days in terms of implementation, and of course, as you all know, we were just going through an election and a little bit of a nail-biting couple of weeks where we were waiting to confirm what our new policy direction would be, and it looks like we'll be headed in a similar direction under similar leadership. So I'm hoping to, not promoting one mandate over another, but just to be mindful of that, but looking for continuity, and I think we have some reassurance that we'll continue to be able to move forward with some of these initiatives. Anything else you want to add? No. Do you want me to talk about Hearth?
We'll do this one and then we'll bounce
Sorry.
back. And maybe I'll just say, if you couldn't see the slide, I think I'm going to say from the Crown Agency level at BC Housing, what's super exciting is this brings together the Ministry of Social Development and Poverty Reduction, Mental Health and Addictions, the Ministry of Health, and Ministry of Children and Family Development very expressly in the plan, which is not something I think we had seen before in that kind of whole of government response. Other groups that are not named on here include our PSSG, our provincial services group around kind of fire, police, and our CMP, which just making sure these systems of government are working together is so valuable. I'm just going to share a few slides on a piece that falls kind of under Belonging in BC, but really is a bit of a standalone project that's come online in the last year and a half in BC. We have had an opportunity under that Belonging in BC umbrella. There was a real commitment to data sharing, data transparency, IT and information technology to underpin systems of response. The province brought in something called the Integrative Support Framework, which really focused on making sure that whatever door you came through and getting services, that behind that door, people were connected so you could be met efficiently, that you didn't have to retell your story. We've got a long way to go to make that good in BC, but that direction was super helpful. And it helped us bring pieces together, which we have been, quite honestly, really struggling in BC to try to figure out how to connect. And so earlier this year, it's been a long year, I think it was earlier this year, we actually got approved through the provincial government and with the federal government and BC Housing to have an alignment project around the work of reaching home and the work under Belonging in BC funded by the provincial government. And so really excited about what this means in terms of vision alignment. We noticed in both Belonging in BC and Reaching Home, we really want the same things. We might have different language, we might use different words, we might have been set up to govern these things a little bit differently, but the real magic is going to happen for people if we can kind of get our mandates aligned and really work together. That joint vision and goals document talks about a shared vision of more integrated local governance and broader coordination of services, as well as improved data management and the use of HIFIS data. That the way forward is for federal, provincial, and community partners, our community entity partners, to be clear, to work together to align and build upon and improve the existing local response to homelessness, focusing on 3 goals: integrated local governance, coordinated access, and data-driven approaches. So we had a long way to go, and there's lots of folks in this room who are participants and drivers and leaders in that work. So hopefully you get a chance to talk to some of them about how this is going, both the bumps and I think hopefully the opportunities that are ahead of us in that work. I'm going to turn it over to Erin to talk about Heart and Hearth.
The Heart Hearth programs are 2 new programs that launched under Belonging in BC, and I would say still in early days. These are complex encampment response programs, and they're really intended to give us all better tools in terms of how we all work together. And they're intended to be interim responses while more housing is built in each community. The Heart is about bringing all the partners together in that local context, representing housing, health, different service agencies, local government, and the community and Indigenous representing organizations at that local level, and to really look at what resources are available in each community and then do a better job of coordinating. And doing so in response to, who is it that needs to be served. The Hearth program is a funding stream, and that's to bring on interim housing and shelter options, and to do so in an expedited way. And it's bringing those 2 programs together. That really is what we hope to be the secret of success, to do a better job of complex encampment response. We have communities identified in each region of the province as what we call phase 1 of our priority communities. And so we've got 7 communities and then 3 others that are Hearth only at this time, for a total of 10 communities. They're all in different stages of implementation. So we're still at early days of being able to assess, what's successful and how we might adjust going forward. But I think there's already, enough that we've got some lessons learned where we're tweaking along the way. And I think the different stages of where we're at in implementation is also reflective of the flexibility of the program at that local level, and making sure that the local government and the other partners that are coming together have a strong voice when they work with the province through BC Housing. We have been able to launch, the rapid deployment wasn't quite as rapid as we had hoped, but we've launched, well over 300 units in last year. We're looking at about 650 Hearth units for this fiscal year, and more into next, for a total of about 1,200 units in 3 years in these 10 communities, which we know is in the grand scheme of things is still a drop in the bucket, but I think is quite impactful for those that are being served in this way. We also recognize that the Union of BC municipalities and several local governments have been calling on the province to expand these programs, and I think that's really reflective of the need that's growing across the province. In communities of all sizes, encampments aren't just a city or urban center challenge anymore, and we know that communities of all sizes in different parts of the province are now having the same experience. So I think that's one for us to take away. But I'll pause there and hand it back over to Allison.
Okay. Well, we felt pretty strongly that after lunch is not the time to sit and listen to a lot more slides, especially on day 2. So what we did want to do in this second part is really make this a BC meeting, and have conversation as partners in BC and with partners from other parts of Canada who want to hear what we're up to and what we're working on. I'm looking at how we've sorted ourselves out. I'm feeling like small town, rural, remote didn't really get as much energy as we'd like, and this urban trough over here is a bit massive. So I'm going to suggest, Jamie, put your hand up. Yep, no, just stand there for a second. The row behind Jamie, if that group could take these 3, kind of the urban A group, take these 3 pieces of paper. The back group, Brooke, can you put your hand up? The back in that corner. You guys are going to take those 3 pieces of paper at the back corner. Medium-sized communities, we've got a fairly big cluster back there, so some of you might want to break off to this front set here. And so what we wanted to do is really talk about what's going on in your communities. And we've put a few, and now my slides won't, there's how we're going to sort you out. We put a few topic questions out to the group. So we want to take some time. Sarah, Maria, myself, Aaron are going to come around. If nobody picks up the pen, we will pick up the pen to take notes for the group. So what we're hoping you can start by sharing is what are some of the pressing challenges you're experiencing in addressing homelessness in your BC community? And also then in the kind of second part, after you've done a round, what are the opportunities or recent changes in approach that are proving promising, and why? And I know, having talked to many people in this room in the last 24 hours, there are lots of promising process changes, new programs and initiatives, and this is an opportunity to kind of share that and share the wisdom directly with one another. So I'm gonna get you to go to your groups. You may be able to pull over a chair. You might have to stand, which is good for us, right? And we're gonna give you, I think, about 15, 20 minutes. And then we'll kind of come around, we'll pull everybody back in and do a bit of a listening. Okay?
All 3 pieces of paper for those 2 questions.
Yeah. I feel this is a group of people who can manage this. I feel you choose, how deep you want to go, and we'll split up. Okay. First, I just want to thank everybody for the enthusiasm and rolling with the kind of standing and the moving the chairs. I'll be honest, I expect that of the people who do this work, that you're going to roll with it, because that's what you're doing every day. I'm going to start. I don't know who wants to start. I think there's somebody from each. Oh, great, we've got someone in the back corner, and I'm going to have each corner just give us a bit of a flavor, couple minutes, the highlights, challenges, and the opportunities, and also ask the person speaking to introduce themselves.
Hi, my name is Laverne. I work at Watari Counseling and Support Services, and I run the Yeah Parenting program, which is happily funded by BC Housing. Okay, so some of our challenges are affordability, toxic drug supply, more complex substance use, staff training to be more informed on the complexities of the community challenges, for example, trauma-informed training. Another challenge is lack of CAA, for example, in Victoria, structure. Implementing CAA properly, going rogue. There's a gap in governance structure. Rental subsidies not being high enough, not meeting the cost of living. For example, it's $450 rental subsidy for youths, and it's been like that, I believe, for the last 8 years since I've been running the program. But my hope would be, could the $450 be increased to reflect the cost of living and the high rental costs, etc. Eviction prevention, additional staffing and connection to training. Sector coordination, access SH units at CAA Beyond SRO, increased work connected to immigration, refugee work, and SHR, S not being able to support the most complex. Now the happy stuff, opportunities that we see. So CIHR, Indigenous Alcohol Harm Reduction Residence Program, perinatal polysubstance use, moms and babies housing, Sacred Cradle House, and CAS 7 streams or wrap-around supports, and collaborating with community partners and leaders, different options to obtain rental rebate, collaboration with youth serving agencies, trust and relationship building, more voices from the youths. Yay for the youths. Connecting harm reduction and tax recovery need these to work together. Concurrent continuum of housing programs, creative agency-led partnerships, BC Housing being adaptive to community agency needs, finding alternative funding streams, and lastly, more funding for veteran populations. Thank you.
Thank you, Laverne. I'm just going to point out these three projects right here, if you got really curious about those. Fran Hunt-Jaducci right here from the Aboriginal Coalition. Ask her about those programs. Okay, who is up next in this corner for urban centers? And I'm going to give you the hard challenge, Chris, that you're not going to say the things that were similar to what Laverne, so you're going to try and pull out some.
Okay, I think some of ours are different, so we're good. Our challenge, not enough units. Every single type is somewhere around this circle, but definitely not enough units. Stigma was a huge challenge, and we talked about a variety of different places, substance users, individuals coming out of the correction system looking for housing, myths and misinformation, definitely a huge issue. Power imbalance between landlords being privileged over the rest of the world. We talked about demographics and particular populations who we were struggling to find housing for or needed more housing for, refugees, and a full spectrum of harm reduction to recovery. So not expecting someone who's just gone through treatment to come out and go back into a low barrier shelter because they don't have any housing. Repairs, empty units, huge issue with, in Richmond, you can ride down the SkyTrain and you can see all the empty units along the SkyTrain route. And then the housing system as a whole and how it intersects with poverty. Affordable is not really actually affordable. And then lots of options for low income housing. We need more, but there's a bottleneck. People get out of shelter into housing, and then when they're ready, there's nowhere else for them to go. Did I summarize without saying any of the rest? Opportunities. So big chunk of opportunities at the top here related to mobile health outreach, mental health outreach, and health primary care type programs in supportive housing. Respite care for people who are needing to come out of sort of acute care hospital, not necessarily ready to go back into their regular housing. Huge kudos to tenancy rights advocacy courses and renters' rights so that people going into the rental market have some understanding and experience about their rights. Land use changes, incentivization of density community housing, the new land use legislation, potentially. We haven't really seen how that's gone yet, but we will. Community land trusts and rent controls as opportunities. Outreach worker networks, avoiding duplication of service. Richmond's brought together everyone doing outreach, whether they're from an agency or a faith-based organization or an individual. The Hearth program, Heart and Hearth program, building code changes to a single point of egress, potentially allowing housing to be built more affordably. Accessibility, dedicated units in nonprofit or private buildings, some organizations who are simply buying their own units or renting an entire house and then subleasing those individual rooms. And then post-treatment recovery housing we talked about.
Thank you, Chris. Okay. So this is the, I was told this is the royal corner. All right, Prince George, Prince Rupert, and Kelowna gets to be a royal, I guess. So turn it over to you.
Thank you very much. My name is Oliver Thorne. I'm with the Veterans Transition Network. I was with the rural group, although I am based in Vancouver because a lot of our veterans struggling with homelessness and housing often end up isolating in rural areas. So here to learn more about how those challenges present. Under the challenges category, I think everything that we discussed could be broadly grouped under the idea of access. So the access to affordable housing, obviously an issue that's been in our urban centers for a while, has really crept out into our more rural settings as well. Even when we look past the issue of affordability, also seeing that even just no availability whatsoever, vacancy rates under 1%, 1% to 2% in a lot of our smaller communities. We also see issues of access due to racism, generational trauma, stigma, which other folks have talked about, access to land, the ability to build, and a lack of units, all contributing to the problem. However, on the opportunities side, I think we could categorize it broadly under the idea of appetite. This is a problem that everybody in Canada, but communities in BC in particular, are struggling with, and so there is a great level of awareness and an appetite to solve this problem. So the way we're seeing that manifest is new units coming online through BC Housing, the perhaps change in some of the attitudes around NIMBYism reducing just a little bit, maybe. More collaboration, more funding, more desire for organizations and other sectors moving into this space, like those working on veterans that also want to tackle this problem. What else? One of the other challenges we saw under access is technology, the administrative barrier of folks getting access to services, and often that wait time and that whole stack of paperwork they need to go through ultimately means that by the time they get that service, they've descended deeper into crisis or challenge. So trying to solve that problem as well. Other opportunities that we identified was a greater opportunity for collaboration between sectors, particularly in improving mental health for staff and peers working in homelessness prevention to reduce burnout and keep people in this sector. I think that's it.
Hello, everyone. My name is Jesse Wagenist, and I am the Executive Director of Sparrow Community Care Society. Our primary project is an older adult shelter in Abbotsford, BC, and I am speaking on behalf of our group of medium-sized communities. Before I point this out, I think probably a lot of us in this room know Judy Graves, and I'm thinking right now of what she once said about how if you ask a room full of people what room full of bureaucrats and civil servants, of directors and outreach workers, what homeless people need, you will get a multiple page report with appendices, you'll get stuff on walls. If you have to ask a room full of grade 2 students what homeless people need, you'll have 23 children, 31 if it's a conservative government, shouting out to you, a home. And one of those groups is probably more accurate than the other. So that's the first thing. But we had a lot of work done by our good group here, pointing out challenges and opportunities. We decided to just highlight 3, and it was determined before we listened to anybody else. So they're the 3 challenges that we most wanted to point it out were, number 1 was a lack of day use spaces. This touches on so many different aspects of homeless services. The primary one that comes to mind at this time of year is, even our extreme weather programs suffer and face increased challenges in identifying sites and maintaining those sites in a way that matters because of lack of day use spaces. It's a struggle during the hot days, the cold days, the infinite rainy days that we experience in the Fraser Valley and Lower Mainland. And so that was the first one we wanted to highlight. Another major challenge is lack of staffing, both from a retention end and a recruitment end. And I know that this is happening across social service sectors. I know that in the BC housing landscape, there have been some opportunities for us to relook at wages or be able to get some supplemental cash, frankly, to help raise our wages to those for those of us who are non-union. But it remains a challenge, both on the recruitment and retention end. And another challenge is lack of a central data site. Whether it's HMIS or HIFIS or whatever it may be, I think we've all experienced it in different ways, that the lack of centrality, lack of universal access across the sector can be a major challenge. As far as opportunities go, I think these two are kind of connected. I'm sorry, I forgot your name, but what was your name again? Pascal pointed out that we have a very passionate group of people who work in the sector. And Andrew pointed out that particularly for medium-sized communities, there seems to be an organic connectivity that occurs between frontline staff and managers and directors and municipalities and healthcare systems. So that's a real strength. I think that isn't of course unique to medium-sized communities, but it's really shines in medium-sized communities. Increased access to healthcare. When we talk about recent changes that have proved promising, We, in all of our communities, efforts from health authorities to improve access to healthcare, whether through visits to shelters, whether through ACT teams or ICM teams or iHeart teams or whatever alphabet soup you swim in. That has been a major, there's been some real promising returns on that. Rapid deployment of the hearth beds has been really useful. In the community where a few of us at the back are from, we've seen our shelter beds basically, they're going to have doubled soon, and that is useful and promising and helpful. And that is the end of what I am going to say. Thank you.
That's great. Thank you. Thank you, everybody who stepped up to cover off what you talked about. We've only scratched the surface, of course, in a conversation like this. I'm just going to close this up to say we would love this to be a meeting that's of use to the people in the room. And so Canadian Alliance, as a sponsor, said to BC Housing, do you want to hold, I think you called it last year, the BC Caucus, which sounded very formal. I didn't know what we were going to vote on. And so this year it's the BC meeting, but the format of it has to be of use to you. I know that my organization, your organization, spends a lot of money to get you out here. You've got work piling up back at home, or you're working on it at night. And so any space, even 90 minutes, has got to be a good use of your time. So I'm just going to put CAH on the spot to say we'll work with you around sending out a survey to folks from BC to ask, what do you want to get out of this? If we do it again next year, how do you want the format to work? What would make it useful to you? And even we'll include in there, like, don't have it. I don't want it. Like, I want to come to this and talk to people from other places. If that's what the interest is, then we won't hold a BC meeting. But we hope that next year we're going to see even more folks from BC be participating in this conversation. My experience in BC is that we don't have a space with this intensity of laser beam focus on homelessness. We have a great provincial conference on housing, and there's some homelessness in it, and we have a great shelter and outreach conference, which is very tactical on the ground, but we don't have this space. And I think that's, talking to many people here, that's why you're coming, because you want to talk about coordinated access. You want to talk about HIFIS and HIMIS systems. You want to hear what's working in terms of systems change in other places and learn from folks in Canada. So we are going to endeavor to reach out and ask how we can make this really powerful for BC. And I hope you will all respond and give us some direction on that. And maybe even there might be somebody from BC who wants to help us co-host this next year. I mean, Sarah and I love chit-chatting with each other and deciding how we'll host this thing. But it'd be great to have some leadership from BC in terms of design. So with that, I'll just thank you all for the time and the effort and hope that everybody has a great rest of your conference. So thanks so much.